Hey everybody, Terry Burden here. You know, I remember back in the day, Aunt Betty, who couldn't wait to get that first facelift when they were first happening in the 70s and go under the knife, didn't turn out so great. She kind of looked like she lost her windshield. Things have changed a lot in the ensuing years. There's fantastic technology out there, and I'm here today with Dr. Brent Larson. We're going to talk a little bit about a fat reduction system called Cool Sculpting. Doctor, how are you?
Terry, how's it going?
Good, good.
Yeah, thanks for coming down.
Absolutely. Tell folks about Cool Sculpting.
Yeah, so Cool Sculpting is just some new technology. It's a way we can reduce fat layers, decrease bulges of fat. It's a technology that was developed at Harvard by Dr. Rox Anderson. He's the scientist that invented laser hair removal. And this technology, it cools down fat to about 38 degrees, and at that temperature, fat turns hard. And what the technology is going to do, what the machine does, it's going to kill about 20 to 25% of those cells. And today we're going to put you on the machine, go over how this procedure works, how simple it is, how you can come in here at lunchtime, sit on this machine for an hour, go back to work, and over 1 to 2 months, those fat cells that have been injured are going to die and are going to be cleared from your body. It's that easy.
Well, it sounds super simple. Is it going to hurt, or should I be scared at all?
Yes, so about 75% of my clients say it doesn't hurt. About 25% of them say it hurts. I was one of those clients. I felt some pain. It lasted 10 minutes. So it's fairly intense pinching for about 10 minutes. After 10 minutes, it just goes away. You can read a magazine, surf the internet, whatever you want. So the lower stomach can be some pressure for 10 minutes. Is it worth it? Absolutely.
Well, considering that we're all trying to find the magic bullet, as it were, to lose a little bit of that spare tire, sounds to me like a small price to pay, huh?
Oh, yeah, it's easy. The sides, other parts of the other areas that we treat, those don't hurt. I mean, we have clients that fall asleep while they're on the machine.
Well, that sounds pretty good.
Yeah.
I could use a nap.
Yeah, that's right.
Awesome. Well, should we do it?
Yeah, let's do it.
Excellent.
Okay. Yep, cool. So this is Cool Sculpting. This is what we put on the patient. There's just an applicator here that goes onto the patient. It's going to suck the bulge of fat up into this machine. This is the part that will take the heat out of the fat and will cool the fat down to 38 degrees. And at that temperature, like we said before, the fat will turn hard. And this stays on the patient for 60 minutes. Okay, so the first thing we do is we just kind of assess the fat bulge, see which spot is the biggest area. Go ahead and pinch for me where you feel it.
Oh, it's definitely
just right there.
Kind of underneath the belly button, up above a little bit.
Okay, so when there's fat between the muscle and the skin, that's where the Cool Sculpting works great. If the fat is under the muscle around the intestines, it doesn't work. But if you have a fat layer between the muscle and the skin, just like that, you're gonna have a great treatment. And then we put the applicator on. Okay, so when the applicator goes on, it feels like your whole body's gonna get sucked up into this thing. Okay. It's not. It's just your fat, it's just your skin, your muscle's not going up into the applicator. There's no organs, nothing, it's just the fat, okay? So this just goes on. Okay, 1, 2, 3. In the area that we're treating, you're going to lose about 2 to 3 sticks of butter. It's not a ton of weight, but when we lose 2 to 3 sticks of butter just from this one spot, aesthetically, it's gonna make a difference. Okay, so that completes the treatment. Right. How did it go?
It was fine.
You feel okay?
Yeah, not painful at all.
Okay, great. So what we do now is we just take the applicator off, and we're going to see that your fat is frozen. And at that point, we just massage it back down. It takes about just a few minutes. So I'm massaging here pretty firm. You can see how frozen it really is. It gets pretty hard. And I massage this. It breaks up some of those fat cells. So there's some of the fat cells are going to die just right now as I'm squishing them. It is a strange pain that you feel after the procedure. It's not, your muscles aren't sore, the
Right,
skin
yeah,
isn't sore.
Not used to, your fat doesn't get sore from a workout.
That's right.
Well, it's been a few weeks since I had my cool sculpting procedure, as you can see. I'm here in the studio. I've been back at work, as the doctor said, since the very day that it happened. And had a little bit of swelling and a little bit of numbness in the abdominal area. Nothing bad at all. Certainly nothing that would rise above the level of mild discomfort. And as the doctor recommended, I've done my best to keep a pretty much of a low-carb diet. May have been a few slices of pizza here and there, maybe a little bowl of delicious homemade pasta that probably spiked my insulin levels, might have slowed down the clearing of the fat cells from my body, but for the most part, I've been a pretty good boy. So let's take a look and see what we see. I could probably still pinch an inch, but I think that's more due to my lack of activity and fitness. I've been getting it going here lately, but all in all, definitely better than it was before I had my cool sculpting procedure done. So I would give the process definitely an A for lack of invasiveness. Didn't have to get cut on at all. Didn't miss any time from work, not really too painful, and all in all, a great result. Thanks to Dr. Brent Larson for my cool sculpting. Good time and a little flatter.